so much for being here with us today. It's truly thrilling. Tell me a little bit about yourself, share your name.
My name is David E. Root, MD. I'm a physician. Actually took a master's degree at Johns Hopkins, so I feel like I'm almost home here.
Aw.
I live in California, in the Sacramento area, and I've been operating a office doing occupational medicine in the Sacramento area since 1981, September. Opened up my practice and started doing occupational medicine, seeing some cases of chemical exposures. And I've been asked, well, how did I get into the sauna detoxification area of medicine? Well, in 1982, in the early part of the year, I had two individuals who had been painting the inside of a 750,000-gallon water tank with no personal protective equipment. That's a huge water tank. They're inside of this thing. And with all of the paint fumes and the solvent fumes, they were overcome and developed over time what we call a toxic encephalopathy. And they had memory problems, they had interpersonal relationship problems, they couldn't get along with their wives, they would fly off the handle, so they had anger management problems, many of these things that go along with chemical exposures. I didn't see them until approximately a year after the exposure. And I'm scratching my head trying to figure out how in the world do I help these men get rid of some of these toxic materials that I know that they've been exposed to and undoubtedly still have on board. So I happened to run across a brochure that had to do with a new company that just started up called Body Pure. I got a trifold in the mail, and I looked at this thing and I said, boy, that's really hokey, and I threw it in the trash can. And I got to thinking about it, and gee, that's kind of interesting. I pulled it back out of the trash can. No, 3 passes in and out of the trash can, I finally decided to give them a call, which I did. I went down to the clinic that they'd opened up, and I was presented with a 3-ring binder that literally was about that thick. And they said, okay, Dr. Root, take this home and look at it and see what you think. So I did, and over the weekend I read through this entire binder full of medical articles that had to do with each part of the program of this sauna detoxification. It was put together by L. Ron Hubbard, who started the Church of Scientology, and in about 1978, he was concerned about people that were trying to become Scientologists but had chemical residues from the drugs they'd been doing and couldn't concentrate, they couldn't pay attention, they couldn't function very well. So he put this thing together, and I came across it in 1982. So I put these two men through the program there in that small little clinic, and they actually did quite well. I wouldn't say that they were cured, and I usually don't use the term cured in any of the patients that I put through, but they've been greatly improved. So they were improved, but not as much as I would have hoped. In later thinking about it, I feel that if we had gotten these people into the sauna detox quicker, we would have had a better result. So from that point forward, we started sharing information, and I eventually incorporated that sauna detox program into my office, to my clinic, and used it for approximately 25, 26 years as I practiced in the Sacramento area. So I had a chance to evaluate and treat approximately 4,000 patients using this technique. So that's how I got into it.
Who else was doing it in the world at that time, and who were your colleagues, and where did you continue to sort of evolve it?
Well, the main place where one could get this done was through the Church of Scientology.
Okay.
And I must say, I'm not a Scientologist, I'm a Presbyterian elder, but I'm open-minded enough to look at a new program and make my own decision about whether or not this works. For me and for my patients, it worked really well.
Incredible.
So I incorporated it. And I can tell you that Narconon, which is an international drug treatment, inpatient drug treatment program, which is present in approximately, I think it's 26 countries now. They're spread around the world. They have treated, up to this point, over 45,000 of these drug patients on an inpatient basis. So it's had a lot of exposure around the world. And as far as the medical community is concerned, the medical community is rather resistant to taking something that sounds on the face of it to be so simple.
Right.
And many physicians, when I talk to them about it, have a hard time recognizing that there's really something to it, because we're using sauna, we're using niacin, we're using vitamins and minerals, but it's the way you put all of those things together in a timed fashion that makes this program work. And if I can take just a moment to
I'd
kind of
love to
explain
hear that.
how it works. So we're all heavily contaminated. You, me, the crew here, everyone in this planet is being heavily contaminated with many toxic chemicals, which the body has not in millennia been exposed to until the last probably 200 or 300 years.
Wow.
So the body is not handling all of these toxic materials that we're exposed to. Well, where do they come from? Well, look at all the fires we've had in Northern California, which burn through everything, and all of the residual smoke and particles goes down onto the ground. It gets with the rainwater into the groundwater table. It runs off into the streams. We pick it up in our water treatment plants and so on. Think of all the women who are on birth control pills. All of the residual, the urine goes into the waste treatment plants, but those plants are designed to take care of biologic waste, not chemical waste. Some of it gets detoxified, some of it doesn't, and it goes on through into the overflow, into the streams, goes downstream. The next city downstream pulls the water out, goes through the water treatment plant. Well, those plants also are not designed to take care of many of these toxic chemicals, some of which have very long biologic half-lives. And what that means is that it takes, such as a polychlorinated biphenyl, which is a particularly toxic form of chemical, which is no longer in production in this country, but PCBs have a half-life in the human body of about 10 to 12 years, which means in 10 to 12 years, half of that material has come out of your body, but half of it's still there. Another 10 to 12 years, half of that comes out, etc. You never get rid of all of it. Some of the other chemicals are water soluble, and they don't persist as long. But those very persistent chemicals are storing in the fat stores. Now, how do you get them out of the fat? Niacin, vitamin B3, used in a form that dissolves rapidly, is very safe and it causes no problems. There is a sustained release type of niacin which can cause some liver problems, so we don't use that. And I would caution anyone who's trying to do this program on their own not to use the sustained release niacin. So you can get the rapid release niacin. Causes an intense flushing and itching. It's
Yes.
a very uncomfortable feeling. And most physicians and most people think this is a negative side effect. We use it as a positive side effect because it causes this intense flushing, which really promotes sweating. So we give the patient niacin and we have them exercise. Niacin breaks down fat. Okay, it causes the fatty acids to be released from the triglycerol molecule, and they go, when they're released, the toxic materials also come out of the fat cell and circulate around the body. So niacin does it, heat stress does it, fasting does it. So there are several ways that causes this breakdown and releases these toxic materials. But now you got to get them out of the body.
Right.
Because if they're just circulating around, now they're even more toxic. So we give them niacin, then we have them exercise on a treadmill, a stationary cycle, whatever, for 10, 15, 20 minutes up to tolerance. Some people will tolerate 10 minutes, some people half hour, whatever. And about the time the niacin flush hits them, into the sauna they go. They sit in the sauna, again, up to tolerance. Some people will tolerate it 10 minutes, 15, maybe 20 minutes. Then they come out, they shower, get rid of this material that's coming out through the liquid sweat and the sebaceous sweat or the fatty sweat. That's what carries out all these toxic materials, including the heavy metals, the mercury, the cadmium, the lead. We're all being exposed to those from the residue from all of the oil-fired generation plants, electrical generation plants. So
talk to me about these two different types of sweating, because that's something that many people haven't heard about.
Sure. Everybody understands liquid sweat. It comes
Yes.
off. And in this program, I would tell you, an adult male can sweat up to 1.5 gallons of water coming out of the skin. But the liquid sweat is what we call the sebaceous sweat, is fatty material that is coming out of the skin. And you can feel it. When you've been sweating on a hot summer's day, you feel kind of oily. Well, it's that
Yes.
oil that's coming out.
Oh.
But that's what carries all of the really toxic materials. So
That's
those come out,
fascinating.
and we wash them off, and off they go. So in the standard Hubbard protocol, the patient is on the unit for about 4 hours, 7 days a week, and it averages about 30 days. Some people 3 weeks, some people 5 weeks, some people even longer. But it's a very time-intensive program. So over a period of time, they're removing these toxic materials. But then you have to recognize they're also removing some of the good stuff.
Right.
The vitamins, the minerals, those have to be replaced. And the replacement is based on the level of niacin to which they are using. So we start people out at about 100 milligrams of niacin, which is a relatively low dose. And most people will flush at that level, some people not. It may take 300 or 400 milligrams. So whatever it takes, that's where we start. Then after 2 or 3 days, amazingly enough, this level of flushing and redness and itching subsides gradually over time as you continue with the program, and we up the dose. And over a 4-week period, some people reached 3,500 milligrams, some people 5,000. That's about as high as we would take it. And 5,000 milligrams is the same as 5 grams.
Right.
And that's a very common dosage that many physicians use to lower cholesterol. So it's not a huge dosage, but one has to take into consideration that all these other essentials, the vitamins, the minerals, and the fluids are coming out, and those have to be replaced. So it's all done in a timed fashion. And what happens is we don't ever get all of these materials out of anyone, but we reduce the amount to the point where the symptom complex, which goes along with these chemical exposures, is greatly reduced. There's a thing that I call the straw that broke the camel's back. This is what I'm explaining is that our detoxification, our normal detoxification systems in the body can be overwhelmed. Okay, so if you give too much of a nasty chemical,
Right.
everything breaks down and people get really sick rapidly. And as an example, I cite a lady who never went through the treatment program, but is an excellent example of what I'm saying. She was 50 years old. She was an artist. She painted approximately 20 paintings a year and had done this for 20 years. So she was exposed day in and day out to all of these paints and solvents. Okay, these are very fat-soluble types of chemicals. No problem at all, 20 years, no trouble. So one day she's on the escalator at Macy's department store in Sacramento, going from the 2nd to the 3rd floor. There's a man, an employee up there, cleaning the brass work with this very volatile solvent cleaner, brass cleaner. And she comes up into this cloud of solvent, and all of a sudden, she doesn't know where she is. She's totally overcome. She staggers over to the elevator. The door opens, and she doesn't have the presence of mind to get out of the way to let the people off the elevator. So finally, she gets on the elevator, goes down to the ground floor. She knows she can't drive her car, so she tries to call her husband. She can't remember her husband's phone number. So, but in any case, those detoxification pathways in her
Right.
system were overwhelmed when she went into this cloud. That was the straw that broke the camel's back. So I've been privileged to participate in several overseas contamination problems, and one of them occurred in 1987. There was a plant near Ljubljana, Slovenia, in the old Yugoslavia, and it was about 30 miles outside of Ljubljana. And this lady's job, she was 35 years old, married, not pregnant. Her job was to handle the capacitor that was being manufactured there, and if it didn't leak oil, she threw it in the good box, and if it leaked oil, she threw it in the bad box. And so day in and day out, she was covered with this very hazardous PCB containing oil. And she became so lethargic and could hardly stay awake. She was sleeping 20 hours a day. She had severe memory problems. She started oozing 50 cc's, that's about 1.5 ounces, of blue-green material out of her breasts.
Wow.
She was not pregnant. She was not normally lactating. Her physician in Ljubljana heard about the detoxification program, and there was at that time one located in Los Angeles. So he contacted the clinic there and brought this lady over. On day 5 of her treatment, her breast discharge had totally stopped. She was starting to already feel better. I think it took her 30 days to complete the program. And at the end of the program, her whole outlook was totally changed. She was sleeping normally. She felt near normal. And when we looked at her before treatment and after treatment, serum levels of PCBs, we looked at fat levels. We do a biopsy through the rump, take a great big number 13 gauge 6-inch biopsy needle into the rump and withdraw fat, and then have that analyzed for PCBs. She had the highest levels of PCBs that I've ever seen in a living individual.
Incredible.
They were huge. And she did so well that the people in the plant area wanted to have more of their people looked at and treated. So we sent a treatment team over there. And I was fortunate to be able to go along, and I did physicals on about 30 of these individuals who'd been working in the plant, were heavily affected, memory problems, fatigue, skin rashes, many, many of the same symptoms that she had, of course. And we ended up finding a sauna location where we could actually treat them outside of Ljubljana. And we put, I think, 13 through over a 2 or 3 week period. But these men did very, very well. They improved tremendously. And there were several studies papers were presented from that. But because of political problems, we were never able to get a larger group through the treatment program. Obviously, when you take a small village and the main employer is contaminating everybody in the village and you shut down the employer, then you've just devastated the entire economy for that area. So that was a political problem, and it's difficult to work through when you have those kinds of problems.
Right.
So the detox program works really well. And over the last close to 30 years, I've treated over 4,000 patients, and most of them were drug abusers, but I was involved in many other programs. I went to Russia twice, of course, with the Chernobyl disaster in 1986. Right. There was huge amounts of fallout, and we worked with the Russians to do a study on 15 children who were at that time in the fallout footprint from Chernobyl, and were exposed to high levels of contamination, particularly radioactive cesium-137. And it was interesting with the children, there's a normal decay of cesium in the body. So let's say the normal decay comes down like this. We put the kids into the treatment program, and their decay came way down. So we were getting rid of a lot of stuff. And then at the end of treatment, it leveled off. They ended up about where they would have been anyway. So it helped remove rapidly some of the cesium, but it didn't help that much. But what it did do, it greatly improved the way that they were functioning, the way they felt. They had massive symptoms, not just from the fallout, but from other contamination, and we were able to reduce a lot of that too. So the Russian paper was very interesting.
Remarkable. So Dr. Root, a question for so many of us here in this country. We all have somebody who's being impacted by addiction in one form or another. Most people have it within their families. Opiates are really becoming a huge issue and are being recognized as such. What do you see we can do for our families, for the people that we know that are dealing with that?
Unfortunately, there are not a lot of places around the country where you can get this type of sauna detoxification. Right. There's one set up in Allentown, Pennsylvania. Narconon is another option. Mm-hmm. The main thing is to get them whatever kind of help you can, whether it's through a sauna detox or through a traditional treatment program, and some of those work pretty well. I feel personally that by reducing the residue of those chemicals getting them out of the body, you're reducing the recidivism rate tremendously. But also, I felt that with patients that I put through, they would do better if they had some psychological follow-up. And that's something that needs to be worked on. But some of the programs are pretty good. But someone who's really hooked on high doses of heroin or cocaine probably need inpatient treatment to start with, for sure.
Right.
People who are on lower doses or who are on marijuana and so on and want to get off, there are other ways of doing it. But sauna detox, in my hands anyway, I think worked very well, very adequately.
So for the average person that's walking around, somebody like me, I personally am very passionate about the work that you've done and the work that you're doing, because I've been heavily toxified through different Chinese herbs that I took many years ago, and there were heavy metals that had accumulated through the soil into those little Chinese herbs that I took, and I took them for about 1.5 years, and then when I was ready to have my first child, my integrative medical doctor did a whole variety of different tests, including urine tests, and discovered that I had very high levels of different toxic heavy metals. And so he did chelation therapy, which obviously has many positive but also negative effects. It sounds like what you're doing is far more sophisticated in different ways without the same sort of effects.
When you have very high levels, I think it's mandatory that you undergo chelation treatment.
Okay.
But that works to a point. But after that point, then I think using the sauna on a regular basis, not necessarily in a treatment mode like I described with the niacin and so on, possibly with low doses of niacin, but just getting into the sauna, exercising, which is very efficacious, and getting your blood moving around and keeping people in good health. But sitting in the sauna and sweating out and getting rid of this material, just making sure that you replenish some electrolytes, you replenish the vitamins and minerals, plenty of fluids. But I have a standard sauna at my house, a small one, and I'm in it 2 or 3 times a week. You don't need to do it every day. You can if you want.
Standard infrared? What's the
Well,
difference?
mine's an old one. It's been around for a long time. So it's a standard convection sauna, which just means it heats up the air, and it's the hot air that generates the heat for the individual. The newer saunas, I'm going to get one, and we have one in our clinic, which is long wave infrared. And what happens with that, it penetrates probably anywhere from 3/4 of an inch to 1.5 inches into the tissues, and it's far more efficacious in mobilizing fat, breaking the fat down, and getting more sebaceous fatty sweat coming out. So I've seen one study where in a standard sauna, 97% of the material coming out is water, 3% is the sebaceous sweat. But in a long infrared type sauna, there's about 85% water and about 15 to 13% sebaceous sweat. So you get a lot more sweat. You don't have to spend as much time in the sauna, and the overall treatment time, instead of 4 hours, in our clinic now we're cutting it down to about 2, maybe 2.5 in some cases. So it takes less time, and it's more efficacious.
2.5 hours straight?
On the unit. So
Yes.
part of the time you're exercising, part of the time you're showering, relaxing. So it's not all in the sauna.
Right.
Need to make that clear, because people hear this 4 hours in the sauna.
Yes.
My gosh, I can't do that.
Yeah.
Nobody can. So you don't have to. You just have to spend whatever until you feel uncomfortable. You get out.
Right.
And by the way, we did some studies on core temperature rise. And with the standard convective type sauna, I was seeing core temperature rise of about 1 to 1.5 degrees centigrade, so not very high. Doesn't
And
go
that
very-
has the impact.
that has a huge impact.
Wow.
That's plenty. You don't have to have a 103 temperature to be, that's not healthy. There are some prohibitions about going into the sauna, doing this full Hubbard protocol. And one of them is pregnancy. Obviously, if we're going to mobilize these toxic materials into the bloodstream of the
Right.
mother, that fetus is going to be exposed to all of these nasty things at a much higher level. And in that case, a pregnant woman should not go through this full Hubbard treatment program. Similarly, if she has an infant who is suckling at the breast, she should not be going through it because, as I pointed out with the example of the woman, the toxic materials are actually concentrated in the breast milk. So she must not be doing that. We cannot treat people who are currently taking antipsychotic or anti-anxiety medications or narcotics, because those medications are also very fat soluble. And if we put somebody like that through this program, they will immediately go into full-blown withdrawal because this stuff will be pulled out of their system very rapidly. So we do require that the individual on those types of medicines must gradually wean themselves off and should be off for a week or so before they attempt to go through a full sauna detox program. Similarly, someone who is in a wheelchair who cannot get out of a wheelchair, we just don't have saunas that will accommodate that. So those are the main prohibitions, and I wanted to make sure that that was clear.
One other question I had for you was, you had spoken a little bit about these individuals in Utah that had gone through the program, through the sauna program.
Oh, yes. I was asked to consult on that program, so I wasn't heavily involved in it, but I did go up and help monitor a bit when the program was going. And what they did was they took some of the young folks who had been arrested on various charges, who were on marijuana and other drugs. They put these kids through, and they also treated some of the police officers who went through also, and that was a major part of it.
They treated the police officers in Utah for the contamination of being around the drugs? How did that work?
When the police make a drug bust, particularly with an amphetamine lab, a lot of toxic materials are there, and as they go through the lab, they get heavily contaminated with this material. And so the police officers were having problems just from breaking up these labs.
Wow.
And so they were put through the treatment program. The children, that was a different treatment program, but that was Salt Lake also.
Interesting.
But they had excellent results, as I recall, from that meth cops study, they called it. Yeah.
Well, I want to thank you so much, Dr. Root, for being here.
Get a sauna, really.
Oh, I'm going to.
Yeah.
I'm going to get one right away. You know, obviously we know so much, we hear so much about the importance of saunas, and until it comes from someone like you who's been using them for this many years, specifically for detox, it just didn't resonate.
I have an open mind, and if something works, by darn, I'm going to look at it and take it seriously, and that's what I did with this program.
Thank you so much.
Okay.